Now, we've been telling you a little bit about what you can expect on the Citizen TV Town Hall. Time to get to that. Trevor Mbija on standby. He's got a power-packed panel. They're talking about the challenges of the healthcare sector, opportunities as well, the nurses' strike, entering week 2, day 8. Trevor Mbija, over to you now.
Good evening. Our town hall session begins right now, live from KICC. We are talking about the ailing healthcare system in Kenya. I want to introduce my panelists to you real quick before we get into the discussion. Beginning from my immediate right is Caroline Karugu, Deputy Governor, Nyeri County. Thank you so much for making time for us.
Thank you.
Followed by Dr. Ouma Oluga, Kenya Medical Practitioners and Dentists Union Secretary General, and also the latest co-chair, Global Coalition of Healthcare Workers. Thank you so much for coming in. And then there's Seth Panyako, Kenya National Union of Nurses. Joining us as well is the Secretary General and a man who needs no introduction, Governor Alfred Mutua from the great people of Machakos County. Thank you so much for making time for us. And Governor Mutua, I'll start with you. What, in your view, is ailing the healthcare system in Kenya today?
I think the biggest problem we've had with healthcare in Kenya is that it has been failing for many years. And thank God for devolution. Things are much better now than the way they were. Let me give you an example. You see, healthcare was being run from Afia House, which we used to call Mafia House, because of all the way it used to operate. A house, a building of cartels and everything. Things were going into shambles. So healthcare in Kenya was failing because decisions were being made at the headquarters, and a decision affecting an employee, a nurse or a health practitioner in a small village in Machakos, for example, was being made in Nairobi. So you find that the system was not set up properly to take care of our people. When I became the governor of Machakos, for example, you could smell the placentas of mothers who are given birth from the gate of the current level 5 hospital. You could smell the toilets. You walked in, shambles, people are sharing beds, you know, 2, 3, mtu yuko na ugonjwa fulani, mwingine ugonjwa fulani, they're sleeping in the same bed. But you see, these are things that had gone on for a very, very long time. Now, what has happened is that as a result of the changes that are coming on and trying to catch up with the challenges that we've had, we are suffering from years of neglect. And in terms of countries in the world, Kenya is one of those countries that have really neglected healthcare, on both sides. Our doctors are treated badly, our nurses are treated poorly, our health practitioners have always been disregarded, and also our nurses, doctors, pharmacists have also disregarded the patients. It's a culture that goes back and forth, so the patient suffers.
Okay. Seth? Clearly, Governor prefers that the healthcare stays with the counties. And the question you're asking today is, should it be reverted, having seen all the drama that's going on? Should it go back to the national government?
It has always been my position that first, health was not meant to be devolved the way it was done.
Okay.
What has happened in Kenya was disastrous, because when you talk to the drafters of the constitution, they said the national referral health facilities will remain with the national government. What are the national referral health facilities? These are facilities that constituted the national referral system. And so where did the national referral system begin? The national referral system began right from level 3 all the way to level 6. So the county governments were meant to manage the county health facilities, which were traditionally from the defunct local authorities and the primary health care. But when they politically dismantled the national referral system, destroyed everything, and gave to the governors politically, that is where the problem came in. And we're not trying to say that there were no problem before. The problems were there before. But there's a better way that we can solve these problems. Apart from Honorable His Excellency Governor Mutua, whom I've always held in high esteem, he has done better. But we cannot look at one county. We have to look at the generality of the performance of healthcare system after devolution. It has miserably failed. But him is a good example, where, for example, when he took over the county, he inherited 400 nurses from the national government. Today he has 1,300. Is a good example. He has talked about the state of the level 5. But you cannot take Machakos County out of 47 and say devolution has performed very well, because different governors have different objectives and different priorities. And we do not want Kenya to be subjected to the whims and the priorities of different governors in this country. We want to have a body that will specifically look into healthcare system and manage healthcare system.
All right, Dr. Umoluga. What ails the healthcare system? Because the doctors also were on strike for over 100 days.
Yeah.
This is not new to you.
Yeah, thank you, Trevor, and thank you for the Kenyans who are watching. First, of course, is to thank the many Kenyans for their messages of goodwill and kindness since I was elected the co-chair for the Global Health Workers Coalition. Now, I'm very grateful for that support. Secondly is to ask the question back to you and to many Kenyans, for how long will we be discussing this? And then to just state three things. One, that devolution of health is not new to Kenya. From the 1990s, there was a lot of decentralization of health, and decentralization of health was meant to achieve, one, equity in terms of resource mobilization, and two, there was supposed to be accountability, both social accountability and financial accountability, where it was believed that when the community that is receiving the health services from a facility are in charge, then they will make better decisions. Lastly is to say that decentralization of health, where it has been successful, and in countries where it has been successful, it has been done over a very long period of time. Where it has been successful, the average time is about 35 to 50 years. Okay. In places where, places where it is nicely devolved, it has taken them 70 years to transfer some functions, like in Canada and such kind of places. So what ails the healthcare system in Kenya is the fact that we do not take ourselves a bit seriously, and we have what I call a separatist approach. We have healthcare for the haves and healthcare for the have-nots. I have said this before. The biggest problem is the fact that the people who make decisions, what decisions to allocate money, decisions to treat workers well, they do not consume those services that they are making decisions on. As a matter of fact, they are behaving like parents who go and eat in five-star hotels, and then they bring leftover food to their children. The healthcare that we make decisions on, from my good friend Governor Mutua to myself to Deputy Governor, should be the same healthcare that we consume. But we will sit here and talk as if the people that we want to make decisions on their behalf are third parties. They are those people. They're not us. Okay. But patients are us.
So it's an us against them.
Yes.
Okay. Caroline?
Good. Thank you, Trevor. I think in my view, it's a couple of issues, actually. The Kenyan health care system has been dysfunctional for a very long time, and I want to agree with Governor Mutua. And if you look at how health has been looked at over the years in this country, there is a sense of myopia that we think of the now and we don't think of the future. A classic example is that we over-concentrate on curative measure as opposed to what makes sense, which is preventive and promotive care. So there is a bit of myopia in the way that we look at things in this country. Number two would be, as nations develop, the healthcare systems naturally must develop with the nations. A classic example is, last evening I was reading a report from the World Health Organization that is projecting that sub-Saharan African countries will suffer from NCDs. About 50% of our population will be suffering from NCDs by 2030. That is a projection by the World Health Organization. As we develop our countries, are we developing with the health system in mind? A classic example is, I want to imagine that the CS Health would be put in a panel when they're doing planning for cities and things like that, so that then things like NCDs can be looked at, and when they're planning for cities, we would want to see bicycle lanes, jogging lanes, and things like that, parks where people can, because as we develop, we'll have less time to exercise, we'll have less time to have a good meal, and therefore we are bound to bend towards fast food. So we are not, the healthcare system is not being involved in the pinnacle of decision making.
Let me bring you to what you've just talked about, then. That's the myopia of thinking of now,
right,
and not the future. Your governor just threatened the nurses,
yes,
today,
yes,
and said that they'll get fired if they don't get back to work. First of all, do you agree with them?
Do I agree with my governor? Let me start maybe this story from where it began. In 2017, when the last strike was called, Nyeri County, and the governor had just taken office then, was the first governor to actually pay the arrears, 5 months arrears for the nurses. Okay. He has gone on to engage the nurses. Okay. Over and above that, he has started a program where we're trying to match nurses' specializations to what they do to try and motivate them. Okay. Just on Friday, and I just shared the letter that the governor did write to the nurses on Friday, 4th of February. He said to them, I am looking at reallocating a budget and paying. And
so the governor said that he's going to pay the nurses.
It is in writing, a letter that I have just shared with them. And they still went on strike. So I understand where he's coming from, in the sense that I think that he has tried. He has done, what is humanly possible. He's tried to engage. So when he says that maybe it is time to look at nurses that we can contract and have them in our terms and put them on a scorecard in a performance management system, that is where he's coming from. So it's important for me to...
You're clarifying that the governor actually confirmed that he's going to pay. So
he has, and Seth will just tell you, we wrote a letter on 4th of February.
Have you seen that, Seth?
I've seen the letter tonight. So I'm yet to confirm from my branch officials whether they have seen that letter or not. Because basically what I've seen is the governor is committing to pay at the end of this month. And if that is the commitment, then basically we will be calling off the strike or suspending in Nyeri. Because if there is commitment from the government that they are going to pay, and we have other counties like Mandera that have committed to pay, and we have suspended the strike, there will be no reason why we should not do the same in Nyeri. I've seen the letter tonight. I'll be speaking with my officials right after this show to get the actual picture on the ground, whether they are aware of that letter or not. So I admit I've seen the letter tonight. And but I want to, in a rejoinder, to say there is a notion with the county governments that they believe that a contracted nurse is not an employee, that a nurse on contract is not supposed to join a trade union. I want to correct that notion. An employee, even on internship, is defined as an employee. An employee who is a casual is defined as an employee. And every employee, according to the Constitution of Kenya, Article 41, 2C, has the right to join, form, participate in activities and programs of a trade union. So when you put these employees on contract, we will immediately recruit them and we will immediately bring a dispute, absorb them in permanent and pensionable.
All right, hold that thought. But we have nurses from all over the place. We have nurses from Nyeri as well, and Mashirima is with them. And we'd like to find out, Boni is also one of them here in the crowd. We'd like to find out, have they seen this letter and how come they're still on strike?
Naam, Trevor, wacha tuanze na Boni ambaye yuko hapa. Tuambie ni nani anamhadamu Kenya hapa. Upande wa serikali ya county inasema imetoa barua na kusema kuwa italipa. Boni, jibu lako?
For sure there was a letter that was written.
Kindly just stand. Stand.
All right. Yes, for sure there was a letter that was written, and our branch secretary was served via social media. It was not done officially, and again that was an agreement that we had agreed with the CEC. We'd agreed that she draft a letter where both parties were supposed to sign. That was our initial agreement.
So you did see the letter?
It was not sent officially.
It was not sent officially, but you saw it on social media?
Yes, we also saw it in social media.
Kwa hivyo hadi sasa hamjaipata kikamilifu, mmeiona tu kwenye mtandao?
Tumeona kwa mtandao, hatuiona kwa ofisi.
Caroline?
Hapo utajuaje barua ni rasmi ama ni kush? It must be given officially to the people concerned. So is the county government to blame in this case?
Caroline, you have to respond to that. Was the letter sent officially to the people?
The letter was sent through the CC. I will confirm on what you mean by officially, being served. And if you had a condition that both sides were to sign, then those conditions were not properly communicated by your people to us. So maybe it's an issue of communication, and we're open to, to dialogue. We're open to talk to you. We are more about talking to each other and less about talking at each other. So feel free. It's something that we can rectify for you.
All right.
And I think it's a matter of semantics, because let's be reasonable here. I agree, barua ni lazima ifike vizuri, lakini ndugu yangu ukisikia barabara imefungwa, sio lazima ufike hapo uone imefungwa, ati umeona kwa mtandao kuona na macho yako. So if you receive the letter by social media and you are aware of the letter, even as you wait for the letter to be delivered, I think nowadays in the spirit of moving together, at least Nyeri wamekaa chini wameandika barua bana, wamechora barua. Kwa hivyo mnanipata?
Governor, SRC says they were not even consulted when you got into a deal to pay the nurses. You are one of the people who paid the nurses. How did you manage to do it?
Well, it's a matter of, you see, for me, the reason that Machakos paid the nurses is because of two fundamental reasons. That's a contradiction. It's a very bad phrasing. We paid the nurses because of two reasons. One, we looked at the situation at hand, and we decided that we needed to solve the quagmire that we're facing. Nurses were not functioning. People do not realize this. Even though doctors are very important and you can't operate without doctors, nurses are slightly more important in terms of healthcare, and all doctors know that, because nurses are the ones who do the day-to-day work with patients. You can have doctors in a hospital. If the nurses are not there, you shut down the hospital. The nurses do the work, and they interpret the directives from the doctors. So I realized that it is important for my nurses in Machakos to be able to get back to work.
Okay.
So that was the original premise. The second reason why we paid the nurses is because we entered into an agreement. The union in Machakos, the nurses in Machakos came and we sat down, and they said, this is what has been agreed. This is what was agreed. And we debated, and I told them I can't pay. And then we signed. I think every county signed.
Yeah.
So on the basis of the fact that as a governor, I entered into an agreement, I decided to honor that agreement that I signed into. And I think we need, as a country, whenever you get into an agreement, not to be wishy-washy. That once you agree to do something, that you do it. And if you're not going to do it, you go back to the table with the people you signed with and then change with them.
SRC says it's unsustainable. Do you disagree with them?
It is slightly unsustainable in terms of when you look at
unsustainable.
When you look at the income that is coming in for some counties, but it is sustainable for others depending on your priorities and also how much you can be able to afford to allocate monies. In Machakos, our wage bill has gone up to close to 3.6, nearly 4 million more.
Yeah.
As a result.
Okay.
And so when I sit in my office, I'm asking myself, do my nurses in Machakos deserve to get this pay? And then I looked at them, because I look at nurses also as people with families.
Okay.
They're not just nurses. They are mothers, they are fathers, they have families, they have all this. They are working very difficult conditions.
Okay.
They are working, I have 1,300 nurses instead of 4,500, so they're working in different conditions.
Okay.
So it's a give and take.
It's a give and take. Hold that thought. We're taking a quick break here on Town Hall Session. We'll be back. We're still talking about healthcare. The question we asked you earlier is, should it be reverted to the national government? We'll sample some of your views as well and talk to the nurses who are also with us in the audience, find out what they actually go through in their line of duty and whether this is all about the money and life. Which one comes first? We'll be back in a bit.